Dr. Joseph Barr. I'm a psychologist. I practice in Deerfield, Illinois, and got into performance and biofeedback after I graduated from Indiana University. I was recruited to work at a university stress clinic. I worked with students who had test anxiety and other anxiety kinds of problems, and that really began my professional interest in performance issues. So I began with anxiety disorders, and it evolved into a lot of other kinds of work with students. And these last 10 years, I've been doing a lot of neurofeedback with young adults, and children who have attention disorders, and continuing my interest in performance in general. So sometimes I'll get business people come in and want to improve their performance as an executive. In the 1980s, I worked with the U.S. Olympic team, and in fact, right now I'm working with a candidate for the U.S. Olympic team. I'm working with speech skaters. And in the 80s, I worked with Bonnie Blair, who won 5 Olympic gold medals. So while I don't take credit for those, it was nice to be on the team. So yeah, and biofeedback has an incredibly great application for that kind of work. What I like about it is I contribute. I allow individuals to be at their best. I mean, small things can make big differences. If you're an Olympic athlete and your stress level and your excitement level is too high, you can't be at your best. You can't focus. In the same way, a youngster in a 3rd grade classroom, if they have attention disorders, they can't be at their best. And what's really unfortunate about that is it really discourages kids. They begin to think that they can't keep up with other members in the class. They begin to think that they're always going to get one of the poorer grades on the test, and that begins to impact their identity. And it really, I mean, it's just a pity, and it's something that really can be addressed in. And what's nice about neurofeedback is it's a strategy. I mean, we all know that some medications on occasion can help with attention disorders. Biofeedback is a way of helping the kids learn to handle that kind of stuff without medication, and that's kind of like an added kind of a mastery that they can learn to handle it on their own. It's not going to help every kid get off absolutely all medication, but 6 of 10, so that's a pretty good batting average. So I've been doing the neurofeedback in good part for the last 10 years. From the beginning of my work in biofeedback, I worked with headache patients, and that's another population that certainly can find some of these physical complaints really pretty disabling. One of the first folks I worked with was was actually a university professor who would get 2 to 3 headaches a week, two to three severe migraine headaches a week. And the only way he could handle those would be to go home and go to sleep, kind of get into a dark room, and so, I mean, one day he'd be having headaches, and the next day he would be essentially recovering from the headaches, and he was really pretty wiped out. A couple days. I mean, this was really quite a major disability, and the biofeedback made a huge difference. There's a big body of literature acknowledged by mainstream medicine that biofeedback is a great way to prevent headaches. So that's a big part of my practice, that and the performance issues. After my work at the university clinic, I was hired by Lutheran General Hospital, where I developed a biofeedback stress clinic. Worked there in the early 1980s. Developed that program, and then went into private practice in the later 80s. Like I said, I'm located at Biofeedback North in Deerfield. And there, the bigger emphasis on working with the neurofeedback to address attention issues, starting to do a little bit of biofeedback we're starting to work with patients who have post-traumatic stress disorder. We're recruiting some veterans. We volunteered to work with some veterans to help them recover from some of their injuries that they got in Iraq. So I'm really excited about that. Kind of fits with just my interest in creating opportunities for folks. what's kind of neat is that we tend to think of ADD problems as something that impacts kids, and it does, and it's real obvious in the classroom, but it also impacts professionals as well. And the last couple of clients that have come into my practice, one is a physician, and the other is an architect who recognize that something's up, and they want to handle it. So it's really pretty exciting.